Year 2020. The whole world came to a sudden halt due to the COVID-19 pandemic. This unforeseen event led to a prolonged period of lockdown that stretched over 3 years, affecting almost every aspect of our lives, ranging from employment and livelihoods to educational pursuits and the broader business landscape. Almost 7 million people are estimated to have died of COVID-19 globally. The pandemic is our biggest concern, that would cause more deaths than even the largest battles in history. No nation will be immune to the issue this will cause. The economy will collapse, and humanity will pay an awful price. While COVID-19 pandemic is almost over, healthcare professionals are sounding the alarm about a potential new pandemic that could be 20 times deadlier than COVID-19 and could take nearly 50 million lives. The World Health Organization introduced Disease X to the world as a placeholder for the next unknown pathogen that could trigger a serious pandemic. The possibility of what Disease X could be is a new agent, a virus, a bacterium or fungus, without any known treatments. The World Health Organization has chalked out Disease X as priority disease under their scanner at the present. Disease X has led to deliberations across the world, with many experts claiming that it could be a zoonotic virus, while others claim it could also be created by humans, to be used in a biological attack. To better understand Disease X, let's first understand how viruses work, and how they have the potential to evolve into pandemics. Viruses were among the earliest life forms on the planet, but they're not alive like we are. They need to hijack other living cells to reproduce, and that's their only goal, to survive and replicate themselves. When a virus enters the body, it hijacks the human cells, and gives instructions to replicate itself. When it invades more and more cells causing damage, it can lead to various symptoms like a fever, a cough, or fatigue. But not always. It may potentially lead to other symptoms related to skin or throat, or like diarrhea. Many viruses are airborne and spread when we sneeze, cough, or speak, and can enter us directly through our eyes, nose, or mouth. While many viruses can also live on a lot of surfaces for hours, so people can pick it up and infect themselves. You can be infected and spread the virus without any symptoms, or they can be mistaken for other diseases like common flu. There are around 1.5 million viruses in wildlife that are unknown to us. Any one of those might currently be affecting the human population. When a virus comes from an animal to a human, it's called a zoonotic virus. These kinds of viruses have been causing more and more outbreaks since decades. And there are more others out there that are more dangerous and better at being transmitted, where we've got no cure. They're the biggest risk. A virus is better at spreading if it doesn't make the host that sick. Some animals or birds remain hosts of these viruses, and these viruses don't really bother them. But they can transform into a new virus once they get into the human population. That's what researchers believe happened in case of outbreaks like COVID-19, SARS or MERS, which has mostly emerged in a live animal market. Viruses might evolve getting mutated and jumping across different species, and then getting into the human population. In 1918, the Spanish flu pandemic started when a bird with a flu and a human with a flu met the same pig, which combined those two viruses, creating a new zoonotic virus, H1N1. This new virus was able to infect humans unlike a regular bird flu, and led to a pandemic that took nearly 50 million lives. The most significant diseases are often caused by viruses that are silent and move very rapidly, causing symptoms like cough or fever that could be confused with other diseases. For disease X to become a pandemic spreading across the globe in a short time, leading to potentially millions of deaths, it needs to strike a remarkable balance between contagiousness and deadliness. A virus that kills people at a very high rate doesn't become a pandemic. A disease like Ebola is much deadlier than COVID-19, but only few people get infected, as the people who have it fall so sick that they stay home, and then most don't survive. While a disease like smallpox was a balance of contagious and deadly that terrorized humanity, killing millions of people. Disease X can have very common symptoms or no symptom at all in an earlier stage of infection. Because of this, the virus can keep spreading to more and more people. But then in later stages, people will end up developing severe symptoms that are life-threatening and may result in deaths of millions of people. But how is the world preparing for disease X? Are we ready for the unknown? Scientists and health organizations around the world are already concerned about disease X that could trigger a pandemic, therefore making efforts in surveillance, vaccine development, and emergency response systems. They are scanning various species of animals and birds around different nations for viruses and flagging the ones that have the potential to harm us. So far, scientists have identified 25 virus families encompassing thousands of individual viruses. Then the government of that nation makes efforts to reduce the exposure of populations to those viruses. But that doesn't mean we are totally safe. In a world where terrorism and violence have become commonplace, disease X may not spread to us naturally but instead may be exploited to launch a biological attack. Disease X could be an engineered pandemic pathogen. Incidental laboratory accidents or as an act of bioterrorism might lead to a disastrous disease X, which can potentially pose global catastrophic risk. So, to combat viruses that can cause disease X, the best way may be to build herd immunity. When viruses spread through a population, some infected people die, but others survive. Their immune systems have learned to recognize and fight the virus. When that happens in enough people, it's much harder for the virus to spread. The rate of infection slows down and the virus dies out. But with disease X, if we just wait to achieve herd immunity naturally, millions of people may die. Which makes it crucial that we develop a vaccine and prepare for mass vaccination drives. If enough people get vaccinated, it's a quick and safe way to achieve herd immunity. But how can we create a vaccine for a disease that is not yet known? Scientists are developing a collection of different prototype vaccines for every threatening virus family. The World Health Organization is working with scientists in developing customizable formulas for creating vaccines. Then, when an outbreak happens, they can sequence the unique genetics of the virus causing the disease and plug the correct sequence into the already developed platform to create a new vaccine. However, vaccines are really hard to develop and require extensive testing before it is truly known if they are effective. And we don't have that much time to wait while the disease keeps spreading and killing. So the best we can do is slow it down, using a method which we have already used: quarantine and social distancing. We have to prepare and normalize avoiding crowds and close contact with other people, so the disease has fewer chances to spread. All the nations and governments of the world must prepare containment and mitigation strategies that involve development and implementation of uniform international guidelines to control bioterrorism. Immediate and appropriate travel restrictions. Widespread and mass testing, surveillance and aggressive contact tracing. Rapid availability of medical facilities. The world will have to prepare for mass vaccination drives and deliver the doses in record time. Also, as an individual we must ensure good hygiene and protect ourselves and our family. Disease X is not isolated from global challenges. Climate change, urbanization, and other factors are altering the landscape of infectious diseases. Individuals, governments, and the international community need to work together to mitigate the risks of Disease X. In the end, it's clear that the next pandemic may be just around the corner. Whether Disease X becomes a reality or not, our preparedness and global cooperation are vital. Let's strive to ensure that the world is better equipped to face the unknown. Thank you for joining us on this exploration of Disease X. If you found this documentary informative, don't forget to like, share, and subscribe to our channel for more thought-provoking content. Stay safe, stay curious, and be prepared for the future.